Welcome everyone to this session on CAPE Index. CAPE is a new tool which is compassion, assertive action, pragmatism, and evidence vulnerability index. CAPE looks at a number of dimensions, and most importantly, there are three things that we need to be considering. First and foremost, is related to the corruption index of a particular country. It is related to foreign aid, and it's also related to Gini index. But one of the major challenges for CAPE is how do we use that to make sure that policymakers in low and middle income countries focus on mental health of the populations. It is a tool which could be and should be used in foreign policy development, particularly related to distribution of foreign aid. Thank you very much.
Hi, I'm Helena, and in this last class of the Geopsychiatry course, I'll be introducing you to the compassion, assertive action, pragmatism, and evidence, the CAPE Vulnerability Index. The CAPE Index is a global index that highlights the need for assistance in countries with a high degree of vulnerability. The index is composed of 9 items and was designed to offer statistical data for assessing the vulnerability in each country. Now I'm going to briefly explain all 9 items included in the CAPE Index. You can find more details of this methodology in the articles included in the reading suggestions. So the first one is life expectancy at birth, and this data is extracted by the World Health Organization. Disability adjusted life years, which is collected by the Global Health Data Exchange. And this unity is the sum of the years of life lost and years lived with disability. Doctors per person, the value is represented by the number of doctors per 1,000 people in a specific territory. And this data was retrieved by the World Bank. Gross domestic product includes data collected by the International Monetary Fund. The Gini coefficient, which is collected by the World Bank, is a coefficient. This is a statistical tool used to measure income inequality, an indicator of a relative wealth rather than absolute wealth. It is derived from individual and household income data. Current conflicts. A list of ongoing armed conflicts were identified, and as well as death toll associated with each conflict. Number of refugees by country of origin. The corruption perception index, according to the Transparency International. This index is a ranking system based on perceived levels of public sector corruption as judged by experts and opinion surveys. And finally, external aid funds per resident population. The value of external aid received from development assistance committee countries. The proportion of the amount acquired and the resident population in the country is calculated. The CAPE Index variables are associated with the prevalence of mental disorders globally. Life expectancy is affected by the health-related variables such as environment, lifestyle, and access to healthcare services. Mortality rates may be due to both factors, medical conditions and death from injuries. The Global Burden of Disease study in 2019 showed that between 1990 and 2019, the number of disability-adjusted life years due to mental health increased by 44.5 million. The current political and civil conflicts worldwide are also considered the leading factors to mental disorders and substance use disorders. Currently, violent civil conflicts disproportionately afflict middle and low-income countries and are recognized as risk factors for mental disorders. In the last decade, more than 100 million people have been displaced globally. This frequently leads to a traumatic experience because of insecurity, persecution, violence, and the lack of medicine and food. Even after a few years of resettlement, there was a relevant rate of mental disorders among refugees. All countries, as described in the World Bank database, 193 in total, were considered for data extraction during the computation of the CAPE Index. Data from 193 countries was analyzed, including 47 from Africa, 35 from the Americas, 53 from Europe, 27 from the Western Pacific, 11 from Southeast Asia, and 21 from the Eastern Mediterranean. After extracting the values of each item for the CAPE Index, countries reporting no data on all items were excluded, except for current conflicts and external aid received, because we found countries without conflicts and countries not receiving external aid. After exclusion of 193 countries, 137 countries reported the CAPE Index information. In a second step, we ranked the values for each CAPE item, allocating 137 positions. Afterwards, we added the number of times each country reached the top 20 position in each ranking order. Figure 1 and Table 1, which I'm going to show next, present the 23 countries which have CAPE Index scores higher than 3. Four countries from Latin America, which is Honduras, Colombia, Haiti, and Guatemala, one in Southeast Asia, Myanmar, and one in West Asia, Iraq. The remaining 17 countries were located in sub-Saharan Africa. This table presents the prevalence of mental and substance use disorders among the 23 countries with higher CAPE scores. The average prevalence of mental disorders was 12.45. The highest prevalence was found in Sudan with 15.99%, and the lowest in Azerbaijan with 10.42%. Regarding substance use disorders, we found an average of 1.71%. The highest value was found in Guatemala, 3.67%, and the lowest value, 0.73%, in Sudan. This table presents the prevalence of mental and substance use disorders of 22 countries with the highest quality of life indices, including Australia, Austria, Canada, among others. No countries from Africa or South America were included in this group, with most of these countries located in Europe. The average prevalence of mental disorders was 15.07%. The highest rate was found in Australia, 19.35%, and the lowest rate in Japan, 10.58%. Also, there was an average prevalence of 3.55% for substance use disorders in these countries. The highest prevalence was found in the USA, 6%, and the lowest prevalence was in Oman, 0.83%. This study aimed to investigate the role of global vulnerability on mental and substance use disorders prevalence. Authors were particularly interested in how the CAPE Index has been correlated with the prevalence rates. Surprisingly, they found a lower prevalence of these disorders in highly vulnerable countries than the wealthiest ones. The vulnerability of these countries was reflected in the rates of mental disorders, and such differences were even higher for substance use disorders. In view of such finding, there is an urgent need to detect mental and substance use disorders in vulnerable countries. These results suggest the lack of data related to mental health in countries with higher vulnerability, since they should show higher risk of mental disorders. Another explanation may include a poor knowledge regarding mental disorders and a low rate of mental health services utilization in these regions. Another point that the authors argue may be the number of psychiatrists working in mental health services. In New Zealand, for instance, with the third highest prevalence of mental disorders among the wealthiest countries, a rate of almost 30 psychiatrists per 100,000 population was found in 2016. The USA reported the highest prevalence of substance use disorder and a rate of 10 psychiatrists per 100,000 population in 2016. Authors found a very different scenario regarding mental health settings through the Vulnerability Global Ranking. In Sudan, they found a percentage of 0.08 psychiatrists per 100,000 population, as well as in Guatemala, slightly higher number, 0.4 psychiatrists per 100,000 population. Based on this data, it is possible to suggest that those countries reporting lower rates of psychiatrists may show an underestimated prevalence of mental illnesses. And here is the distribution of mental disorder prevalence between countries according to the socio-economic status. In conclusion, the authors of the CAPE Vulnerability Index found a lower prevalence of mental and substance use disorders in highly vulnerable countries when compared to wealthier ones. In view of such surprising findings, there is an urgent need to detect mental and substance use disorders in vulnerable countries. Even though the CAPE Index indicates countries' vulnerability, unfortunately, authors could not confirm high rates of mental and substance use disorders in these regions. This may be due to the lack of data and lower access to mental health services. Increasing mental health literacy among non-specialized health professionals may be of utmost importance in these areas. The employment of this MH gap, which aims to train health professionals to provide care in mental health, might improve the level of detection and treatment. Further research is needed in this field, as well as action plans should be promoted in the interest of vulnerable communities. And how can the CAPE Index be used? The CAPE Vulnerability Index, designed around the principles of compassion, assertive action, pragmatism, and evidence, presents a promising avenue for seeking funds to advance research, provide assistance, and execute humanitarian interventions within the realm of mental health. Leveraging its global foreign policy approach, the index could serve as a compelling tool to advocate for financial support from various stakeholders. By utilizing the index, organizations and researchers could identify countries that are most in need of foreign aid to address mental health vulnerabilities. This evidence-based framework offers a structured and objective approach that resonates with potential donors as it prioritizes aid allocation based on clear indicators and transparent criteria. In the context of research, the CAPE Index could be used to underscore the urgent need for comprehensive studies, data collection, and analysis in countries exhibiting higher vulnerability scores. The index's rigorous methodology, relying on internationally validated indicators, provides a strong foundation for building research proposals and justifying the allocation of funds to investigate mental health challenges, determinants, and potential interventions in these nations. Furthermore, the CAPE Index aligns seamlessly with the goals of international organizations and foundations dedicated to mental health advocacy and intervention. By highlighting the mental health disparities and vulnerabilities present in certain countries, the index provides a strategic framework for designing targeted intervention programs. Proposals for mental health initiatives could be developed based on the index findings, offering a well-informed approach to addressing specific challenges faced by the identified countries. And finally, when seeking funds for humanitarian interventions, the CAPE Index offers a compelling narrative. The vulnerable countries identified by the index are often characterized by governmental instability, conflict, human rights abuse, and social divisions. This substantiates the need for immediate and sustained humanitarian assistance to address mental health disparities exacerbated by these challenging conditions. The index focuses on evidence-based prioritization, enhance its credibility and persuasiveness in attracting financial support from governmental agencies, international organizations, and philanthropic entities. In essence, the CAPE Vulnerability Index serves as a powerful advocacy tool that could be effectively employed to secure funding for research, assistance, and interventions in the field of mental health. Its systematic approach, grounded in objective indicators and comprehensive analysis, provides a compelling basis for garnering support from diverse sources, all with the shared goal of improving mental health outcomes and well-being in the most vulnerable populations around the world.